We are from group assignment 1. Basically, our group will explaining about the types of hazard. Before we are going further, I will explaining the introduction. Every job that is done must have workplace hazard. Because of that, Occupational Safety and Health (OSHA) exists and has its own goal based on the United States government official website about OSHA. The main goal of OSHA program is to prevent workplace injuries, illnesses, and deaths, as well as the suffering and financial hardship this can cause. In Malaysia, worker safety is very important, and Malaysia has its own Act law, which is Act 540, which is the Occupational Safety and Health Act AKKP 1994. In every workplace, there are certain types of occupational hazard, such as chemical hazard, ergonomic hazard, physical hazard, and biological danger. All these hazards will definitely harm the workers and affect the health of the workers. Therefore, the report to detect causes, effect, and control all the hazard in the Ampang Superbowl Bangi Gateway area.
I'm going to explain about physical hazard. Physical hazard is a substance element or event that has the potential to endanger life or property. Physical risks can exist both at work and outside, and they can be brought on by either human or natural forces. It also means factors or conditions within the environment that can harm our health. Some common physical hazards include electrical hazards, tripping hazards, noise hazards, and radiation hazards. Physical hazard for this photo is considered as tripping hazard. Anything that could potentially cause someone to trip and fall is considered a tripping hazard. The cause for this hazard is unstable stool for doing the maintenance of bowling center scoring monitor. The effects of this hazard can give employees minor or major injuries, such as broken bones, wounds, bleeding, or head injuries. We can control the hazard by wearing safety helmets or safety belt to prevent from falling down while doing the work. Safety helmet can prevent the head to hit any harmful things like floor or hard items and objects around us while in the workplace.
I'm going to present and explain about biological hazard. Biological hazard is defined as organism or biological condition that poses a threat to the health or well-being of living humans. This hazard can encompass a wide range of biological agents, materials, or situations that have the potential to cause harm to humans. Moreover, they are typically classified into several categories, which is infectious agents. These include microorganisms such as bacteria, viruses, fungi, and parasites that can cause disease when they enter the body. The common examples include the influenza virus, HIV, salmonella, bacteria, and malaria parasite. For more examples, as you can see here at the picture, which is spotted one guy wearing a mask that was improperly worn while at public places. There is a possibility that the guy in the picture may be infected by viruses. The viruses may affect others through the respiratory tract. This is the most common way influenza and COVID-19 are transmitted. When the affected person in the picture cough or sneeze, they release virus particles into the air. These particles can be inhaled by other people who can then become infected. And viruses can cause a wide range of symptoms depending on the type of virus and the individual infected. Some common symptoms of a viral infection include fever, fatigue, muscle aches, headaches, cough, sneezing, sore throats, and more. In addition, some viral infection can lead to more serious complications, such as pneumonia, meningitis, and encephalitis. Lastly, how to prevent virus? There are a lot of that can be prevented from viruses in the picture, which is that include washing your hands frequently with soap. Wash your hand for at least 20 seconds, especially after being around someone who is sick. Moreover, avoid close contact with people who are sick, coughing or sneezing at least 6 feet away. Other than that, get vaccinated against certain viruses such as measles, mumps, COVID-19 and rubella.
Thank you, Hani. After that, I'll talk about chemical hazard. But before that, I will briefly explain what is chemical hazard. A chemical hazard is any material, regardless of its form, that has the potential to endanger people's health or harm the environment. This picture shows that chemicals for cleaning and maintenance are one of the main sources of chemical hazards. Cleaning solvents, disinfectants, and lubricants, for example, might be hazardous if not handled or stored appropriately. Inhalation of fumes or skin contact with these compounds might be hazardous to one's health. Cleaning chemicals frequently contain volatile components that, when utilized, could cause dangerous gases. Frequent inhalation of these fumes can cause respiratory disorders like coughing and wheezing and long-term health problems. Furthermore, skin contact with such chemicals can cause irritation, allergy responses, or chemical burns, which can be painful and irritating. And how to prevent chemical hazard? Employee training is essential for the safe handling and storage of cleaning chemicals in bowling alleys. Workers should be trained in potential hazards, such as inhalation and skin contact hazards, as well as how to use safety equipment such as gloves, goggles, and masks. This understanding allows staff to reduce risk, prevent accidents, and create a safe environment for both employees and customers.
Okay, next I'm going to talk about type of hazard, which is ergonomic hazard. But before I going through more, I will explaining more about what is ergonomic hazard. The definition of ergonomic hazard are environmental conditions that can affect musculoskeletal system. If ergonomic hazards are not prevented, it can have the symptoms to body such as fatigue, discomfort, and pain, which can be the first sign of musculoskeletal disorder. For example, in this picture shows the poor position of sitting for too long, and it can affect on the bones and the body. According to Anna Schaffer, 2017, the causes of the sitting down for too long can compression on the discs in the spine and can lead to the premature degeneration, which result in the chronic pain. In addition, sitting in a slouch position can also overstretch the spinal ligaments and strain the spinal discs. So, how to mitigate the ergonomic hazard? First, the employee can stretching because it can help reduce the rates of injury. For example, the employee can take a break from sitting every 30 minutes and walk around the workplace. In addition, correct posture by not bending the body and placing a comfortable and suitable chair for workers who sit for too long. This will cause the employee to be able to overcome the problem of the body pain. In a nutshell, ergonomic hazards are important to take seriously in the workplace because what begins as a small muscle strain can eventually cause long-term health problems. If these hazards are not addressed, they can lead to injuries and illnesses that affect employees both physically and mentally.
I will talking about conclusion. This report has provided an extensive overview of various hazards that can occur in workplaces and industries in Malaysia, encompassing physical, biological, chemical, and ergonomic hazard. It has emphasized the importance of recognizing and addressing this hazard to ensure the safety, health, and well-being of employees and the public. Ergonomic hazard centered around the science of designing job for safety and comfort have been highlighted as crucial in preventing workplace injuries and enhancing productivity. Proper posture, exercise, and therapy have been recommended as measures to mitigate these risks. Biological hazards, including the dangers of rust and viral infection, have been discussed in detail. Effective preventive measures such as maintaining clean and dry equipment and implementing hygiene practices have been emphasized. Chemical hazards have been elucidated with a focus on cleaning and maintenance chemicals. Employee training and safe chemical storage procedures have been underscored as essential elements in safeguarding both workers and customers. Physical hazard exemplified by tripping hazard and noise exposure have been addressed comprehensively. Countermeasures, including the use of safety equipment and maintenance suitable working conditions, have been advocated. So, this report serves as comprehensive research for recognizing, understanding, and mitigating various workplace hazards in Malaysia, contributing to the promotion of safety, health, and overall well-being in diverse work environments. Thank you for your attention.